This is going to be a demonstration of how to identify where to put your electrodes for V1 through V6 for your 12 lead EKG. So first of all, we have to uncover the chest. So then you're going to identify where the clavicles are. I've got, your right and left clavicle here. You've got a sternal notch and the angle of Louis, which can be helpful in terms of figuring out where the second intercostal space is. But I've actually found it just as easy and just as effective to grab the mid-clavicular, at the mid-clavicular line here, grab the clavicle just gently with my finger, and then find that first space between the ribs. Find that first space with my thumb, and it's usually about this distance for most people. So I find that space, and then I keep my finger and my thumb the same distance apart, and I come down. So this was my first intercostal space. This is the second. This is the third. And then this would be the fourth. So if I end up, I tend to go in an angle so that I end up closer to the sternum, because that's where you want to place it. If you went straight down and you ended up way over here, you want to bring, come over, bring your thumb over, make sure you're following that intercostal space, and put your electrode over here right next to the sternum. And you can do the same thing on this side. However, once you have identified your fourth intercostal space, you can easily just come right over and identify the fourth intercostal space on the patient's left side and place your V2 electrode here. So now I've got V1 and V2 placed, okay? Now the next one you want to consider placing is V4, not V3. You'll understand that in a second, but you want to place V4 because I've found the fourth intercostal space. Now I just need to come down and find the fifth. So I reach down, I feel for where the fifth intercostal space is. Now, for a man, it's fairly easy to just kind of come over and put my V4 electrode over here more. But for a woman, you're going to have to probably ask her to raise her breast, and then you just come right over and try not to put it on the breast tissue as much as possible. So as much as possible over the fifth intercostal space and coming over more closer to the mid-clavicular line. Okay, so this one's not supposed to be close to the sternum. All right, so then I've got V2 here and V4 here. I'm just supposed to take V3 and put it between the two. Okay, so I just place it between V2 and V3, just sort of pick a spot there. Now when V4 is here, then I'm gonna think about placing V5 and V6. V5, if you think about coming down from just this inner aspect of the armpit here, just come down and right there, again along the V5, the fifth intercostal space, you'll put your V5, and then V6, just come down from the armpit and put it horizontally just right next to V5. And you should be good. Once you get your leads all clipped on there, you can cover your patient up and give her a little privacy until you run the test. Okay? So I hope that was helpful.